So what is breast cancer? It's important to know that the breast tissue is made up of three structures, which are glands, ducts, and connective tissue. These tissues are comprised of various cells that make up the entire breast. What can happen is if these cells start to change their structure and grow at an abnormal rate, they can form precancerous cells, which potentially could become cancerous cells and develop a tumor. Some tumors are benign and have no significance. Others can develop into full cancerous tumors that can become malignant, and that's concerning because malignant tumor cells can move to different parts of the body. Some of the symptoms that are important to be aware of when breast cancer is a concern is the change of the size and the shape of the breast, any new lumps or bumps that are found in the breast, any lumps or bumps that have been there before but have increased in size, any discharge or even bloody discharge from the nipples, or if the nipple starts to turn inward. Also, skin changes that show red, flaky skin can be concerning as well. These symptoms could be something else, but the only way to know for sure is with screening. And early screening and detection could save lives. For the latest statistics on breast cancer, please refer to our PDF of Breast and Cervical Cancer Toolkit. Some of the risk factors regarding breast cancer obviously include female gender, much more common in females than men. Age, more breast cancers are caught in women, at least 12% above the age of 45. The more invasive ones are caught in women greater than 55 years old. Family history is significant, especially first-degree relatives who were diagnosed with cancer before the age of 50. Race plays a significant role, more commonly in Caucasian women and African American women, and then not too far behind Hispanic women and Asians. Genetic factors play a role as well. The BRCA1 and 2 genes can be significant in determining if someone will develop breast cancer. Hormone replacement therapy after menopause, or even entering menopause later, like around 55 years old. Other risk factors are delayed childbearing age, greater than 30 years old. Alcohol, weight, obesity played a role in increasing risk factors for developing breast cancer. Smoke exposure, whether that's your own tobacco consumption or being around secondhand smoke. Some of the things that can help reduce your chance of getting breast cancer are diet and exercise. A diet that consists of a heavy amount of fruits and vegetables, lean poultry, fish. Exercise alone can reduce women's risk factors of getting breast cancer by about 25%. And another unique factor is breastfeeding. And if breastfeeding is done for between 1.5 to 2 years, it can actually lower the risk factor by 4%. With all those factors being said, again, early detection and screening is important. Once the clinical exam of the breast is completed by your clinician, often they'll make a referral for a mammogram. The mammogram will look at the density and the structural integrity of the breast. From there, it is possible that the radiologist may detect something unusual on the mammogram. He or she may end up consulting your clinician to order an ultrasound of the breast with a diagnostic mammogram that's a little more detailed. Some other additional testing could include tomosynthesis, which is beneficial for dense breast tissue as it provides a 3D image. From there, if there's any concerning densities or masses that are found through the diagnostic mammogram and ultrasound, sometimes further testing is done with MRI and biopsy of the tissue to see if we're dealing with a cancerous tumor. There are 4 different types of breasts, ones that are predominantly fat, others that are heterogeneously dense, scatter densities, and then there's the more extremely dense breasts. Another noteworthy situation is women who have breast implants. If this is the case, often the technician, the radiology technician, will take further pictures when doing a mammogram. Sometimes they include 3D imaging just to get a better picture of the breast tissue. Now, while mammography and diagnostic mammography and tomosynthesis are very beneficial for detecting breast cancer or any concerning tumors or masses in the breasts, what's really important is that women continue to follow up with their clinician for further breast exams on a yearly basis. That is the most effective way to screen and prevent any risk factors for developing breast cancer.